Disorders associated with lipoprotein metabolism. So first the lipoprotein means it is a lipid and a protein. The lipid compounds are relatively water insoluble. Therefore, they are transported in plasma as lipoprotein aqueous. The protein part is apoproteins or apolipoproteins. The apoproteins may be structural or transferred. On the other hand, the lipid part, each lipoprotein contains different types of lipids in various combinations, which include in the lipoproteins and related clinical problems, the atherosclerosis, hypertension, coronary heart disease. Lipoproteinemias include hypo and hyper, followed by the fatty liver. And the types of lipoprotein, which include the chylomicrons, VLDL, very low density lipoprotein, LDL, low density lipoprotein, HDL, high density lipoprotein. The plasma lipoproteins are nothing but the triacylglycerol which transport. It may be chylomicron, triglyceride of dietary origin, VLDL, triglycerol of endogenous synthesis. For cholesterol transport, cholesterol rich LDL or HDL. The LDL mainly free cholesterol, the HDL mainly esterified cholesterol. Disorder of lipoprotein metabolism include hyperlipoproteinemias and hypolipoproteinemias. Type 1 hyperlipoproteinemia, type 2, type 3, type 4. The hypolipoproteinemia includes A beta lipoproteinemia, familial hypo-beta lipoproteinemia. In the genetic classification, these are all the diseases, genetic defect followed by the Fredrickson nomenclature and risk factor. Familial hypercholesterolemia include the reduced number of functional LDL receptors leads to coronary heart disease. Familial hypertriglyceridemia, possibly single gene defect in the genetic defect mechanism. Familial combined hyperlipidemia, possible single gene defect. Lipoprotein lipase deficiency, it reduced levels of functional LPL. ApoC2 deficiency, it is the inability to synthesize ApoC2 cofactor of LPL or lipoprotein. A beta lipoproteinemia includes the inability to synthesize ApoB. A alpha lipoproteinemia includes the inability to synthesize ApoA. Here, these two, A beta lipoproteinemia and A alpha lipoproteinemia, not categorized in the Fredrickson classification. Type 1 hyperlipoproteinemia include the familial lipoprotein lipase deficiency due to deficiency of lipoprotein lipase or ApoC2. Here the slow clearance of triglycerol rich lipoproteins in plasma, which include the chylomicron VLDL. Hypertriacylglyceremia, which includes the increased triglycerol in the blood, which can be treated by reducing fat in the diet. The type 2 hyperlipoproteinemia, otherwise known as familial hypercholesterolemia, due to the deficiency of functional LDL receptors, there is a reduced clearance of LDL. Here, elevation of plasma cholesterol, but plasma triglycerol remains normal. Predispose of atherosclerosis and coronary heart disease. The type 3 hyperlipoproteinemia, which includes broad due to abnormal ApoE on chylomicrons, reduction of clearance of chylomicron by liver, accumulation of chylomicron in plasma, hypercholesterolemia, predispose of atherosclerosis and coronary heart disease. Type 4 hyperlipoproteinemia include the familial hypertriacylglycerolemia, increased production of VLDL, very low density lipoprotein, commonly associated with type 2 diabetic mellitus and obesity. Elevated blood triglycerol and cholesterol, predisposed to atherosclerosis and coronary heart disease. A beta lipoproteinemia, defect in triacylglycerol transfer protein MTP, response for loading above 100 with lipid with no chylomicrons or no VLDL synthesis. No chylomicron synthesis leads to intestine blood triglyceride, no VLDL synthesis in liver and increased triglyceride in the liver, no VLDL synthesis, no LDL blood cholesterol. Familiar hypo-beta lipoproteinemia includes the ApoB100 synthesis, VLDL blood triglyceride and increased triglyceride in liver, LDL blood cholesterol. Thank you. This PowerPoint presentation was prepared by Ms. Reshma Aruldas, current second MSc Biochemistry student of Sacred Heart College, 2022 to 2024. Thank you one and all.